we're going to talk about disinformation regarding health. Disinformation about vaccines. We know that the phenomenon of disinformation is nothing new. We have many myths, a lot of disinformation circulating around, and they are linked to vaccines. Among the most widely known was a study in 1999 establishing a connection between autism and the DPT vaccine, and this study, even though it was retracted and clarifications were made, it damaged trust on vaccines. And this study is still circulating around, unfortunately. What we saw is that during coronavirus pandemic, there was a lot of disinformation about COVID-19 vaccines. The phenomenon of doubts about vaccination, about hesitancy, this had been called a threat, a public health threat, and it could jeopardize the achievements made with vaccination campaigns. Unfortunately, there was a lot of disinformation about COVID vaccines, and these rumors circulated over social media and many of these platforms, and this can erode trust in vaccines, not only COVID vaccine, but also other vaccines in general, vaccines that are part of the vaccination program of each one of our countries, which is why it is important to continue to dispel these rumors so that people can make decisions based on evidence and protect their own health and that of their family. As I said, or as Olivia was telling us recently, we are part of an organization called LATAM Chequeado, which is a collaboration among different countries in the world. We have over 30 organizations in Latin America, and we verified this information which were related to pandemic. And in LATAM Chequeado, vaccines was also specifically focused on COVID-19 vaccines. So it is very important to check around, and all the work we've done with COVID-19 vaccines is great. So the disinformation that was circulating in Argentina, and then they would go to Argentina or other Latin American countries. So we developed a list of the most common disinformation bits that were going around. So first of all, there is the disinformation related to vaccine development. For example, that the vaccine was just an experimental thing, that they were approved too quickly, and that this led to some doubts about their safety. And also disinformation that said the vaccines were not effective. This disinformation for example, here, it is false that Pfizer marketed its vaccine without testing its efficacy. So this is the kind of thing we used to do. So this is false, and we would give it the false stamp. There was a question about whether the clinical trials had confirmed the effectiveness and the person said no for virus transmission, specifically virus transmission. So this answer was totally taken out of context. And this was used to say that somebody at the European Parliament had said that the vaccines were not effective, when the reality was that the question, as I said, was out of context. What the person had answered was that clinical trials were not done to verify or to test whether the vaccine could prevent transmission. No, that's not the point of clinical trials, but the clinical trials is to prevent symptomatic disease and to prevent deaths and hospitalizations. So you can see how an answer to one question, when you say no to that question, then it becomes disinformation because it is completely taken out of context. Also, we have disinformation related to the vaccine makeup. These are things that have circulated with other vaccines in the past, not COVID, that they have heavy metals, that and this was circulating through TikTok and other social media, that the vaccine could magnetize you and that people would be in danger. And if you put objects on your arms, they were magnetized. And also that the vaccines had microchips in them that would then allow people to follow you because you had that chip, or also disinformation about vaccines having graphene. So many of these pieces of disinformation are based on the fact that many times there is not reliable, accurate information. There is ignorance, lack of knowledge of how vaccines work. But vaccine components are public, they're open. People can ask what they have and they can learn what vaccines have. But since there is disinformation, since there is not reliable information among some groups of the population, then this becomes disinformation. This is why it is so necessary to have good information so that doubts are not generated. Also, disinformation related to how the vaccine works. Many of them have to do in particular with messenger RNA vaccines and the fact that supposedly they modify DNA or they can generate genetic damage. Again, ignorance about how vaccines actually work, especially how messenger RNA vaccines work, even though they are not new for the scientific community, but they were new for the general public, for the general audience. The population in general. So as journalists, we need to educate ourselves, understand how they work, and be able to respond people's doubts about them. That's part of our role. This one is very common and it's circulated in our region, and it has to do with alleged adverse effects and deaths related to COVID-19 vaccines, that the vaccine can leave you sterile, and that the vaccine has multiplied deaths in Israel by 40. So all these things are disinformation, and they are based on confusing causality and correlation. Sometimes you can have an event occurring simultaneously with another one. For example, I can get a vaccine and then I twisted my ankle. So to know that there is an actual cause-effect relationship, well, it's the vaccine that made my ankle be twisted. Well, you need to do research. There has to be a lot of research by the scientific community to establish a true correlation. But a lot of the disinformation is based on correlations, but not causality. So then we have all the information related to campaigns, to the vaccine campaigns, immunization campaigns on the field. Oh, that the syringes didn't have needles, or all these things, or some other myths that said that, oh, it's better to have your own natural immunity than the immunity conferred by vaccines. So the immunity achieved through vaccination is more robust and persistent. And this, as journalists, we need to learn this and to spread that information. So And all of this outweighs the possible side effects that are usually mild and are resolved within 24 to 48 hours. So now the disinformation pieces that we saw, especially at the beginning of the pandemic regarding COVID-19, then went further, and they were combined with other diseases, and there were all these false links. For example, with the outbreak of monkeypox this year, people tried to make a connection between COVID-19 vaccination and monkeypox, or that COVID vaccine could cause monkeypox, especially related to the AstraZeneca vaccine, because they use as a viral vector chimpanzee modified DNA. So it's something that is completely innocuous. But since they had used the chimpanzee DNA in AstraZeneca, so people would link it to the monkeypox without considering that when you talk about monkeypox, it is a disease that is endemic in parts in Africa, and it has already caused outbreaks in other places much longer ago than the appearance of COVID-19. So now we have a situation of polio, which was described by Dr. Salas, and there was a resurgence of some disinformation that is related to the polio vaccine, which is related to some campaigns to booster polio. And this is happening in the Americas, and there are false links between the polio vaccine and cancer, and there's also conspiracy theories where Bill Gates is the bad guy, and these disinformation pieces says that the polio vaccine would be causing polio outbreaks in India, and so all of this is false.
So this is the most common disinformation in connection with vaccines in general, and also vaccines in connection with coronavirus.